This is News 6 at 11. I'm Matt Austin.
And I'm Lisa Bell. Major changes are coming to Florida's vaccine rollout. Tonight, we have team coverage on where the next eligible Central Floridians can get the shot. News 6's Nikki Zizaza is looking into the confusion some people are facing just hours before the expansion. But first, we start with News 6's Lauren Cervantes live in the newsroom with reaction to President Biden's new vaccine timeline. So, Lauren, what are local leaders saying about this?
Lisa, the EMS medical director for Seminole County tells me in order to meet President Biden's timeline that he laid out tonight for both educators and adults in general, Dr. Todd Husty says it'll be dependent on how quickly they get more vaccine.
Two of the largest healthcare and pharmaceutical companies in the world that are usually competitors are working together on the vaccine. Johnson & Johnson and Merck will work together to expand the production of Johnson & Johnson's vaccine.
President Joe Biden making the announcement that both companies will partner to ramp up vaccine production, adding that Johnson & Johnson vaccine manufacturing facilities will begin to operate 24 hours a day. But the president made another statement, laying out a timeline.
I'm pleased to announce today, as a consequence of the stepped-up process that I've ordered and just outlined, this country will have enough vaccine supply, I'll say it again, for every adult in America by the end of May.
But is that feasible? We asked Dr. Todd Husty, the EMS medical director for Seminole County, who says they are prepared to handle more vaccine.
We're nowhere close to maxed out. So I think if they can bring the vaccine, maybe we'll hit that end of May, every adult one dose. Yeah, I'm very hopeful. That would be great.
President Biden also laid out another timeline, this one specifically for educators and child care workers, calling them essential workers and asking the states to make them a priority.
Today, I'm using the full authority of the federal government. I'm directing every state to do the same. My challenge to all states, territories, and the District of Columbia is this. We want every educator, school staff member, child care worker to receive at least one shot by the end of the month of March.
A plan that Dr. Husty says is also contingent on how quickly counties can receive more vaccine.
If they wait more than a week or a week and a half to tell us how many doses we're getting and when, I don't think it'd be feasible. But if they really crank it up and say, we're going to get X number of doses and it's going to keep coming until all the educators are done, all the school teachers are done, I mean, we can get it done. We just have to have the supply.
Dr. Husty says the hardest part of meeting these timelines is the lag time between when they are told how much vaccine they'll be getting and the time it takes to actually receive it in the county. Matt?
Lauren, thank you.